Hi, so the purpose of this video is to give you a structured and validated method for teaching practical skills. Some of you may be familiar with this, especially if you're instructors on one of the life support courses, but we're hoping to give you some hints on how it can be transferred and used in a clinical setting during a busy theatre list. So the main learning objectives of the video are to describe the spectrum of expertise from novice to master, to describe the Kolb learning cycle, to describe the 5-step teaching technique, and to also demonstrate the 5-step teaching technique. The 5-step technique is based on the principles of the taxonomy of the psychomotor domain, and the main benefit of this is that it allows learning in a limited time frame. As you can see from this graph, an individual new to a skill presents increased risk to their patients. Ultimately, the rapid acquisition of competence is to everyone's advantage, especially the patient. In order to accelerate the transition from incompetence to competence, you need to consider Kolb's learning cycle. As a trainer, it is really important that you facilitate this learning cycle for your trainee to take advantage of any learning opportunities. For example, active experimentation, use of mannequins before or after a clinical experience. Concrete experience. Clinical experience. Consider altering your practice to facilitate expertise development in some skills. Reflection and abstract conceptualization. Feedback on performance is absolutely essential for skills training and expertise development. Ultimately, Kolb's learning cycle creates a cycle of deliberate practice which is necessary to develop expertise in an efficient and effective way. Okay, so we'll go through an example of some practical skills teaching and we'll explain what we're doing as we go along. Hi Rachel, thanks so much for helping see the patients for the list this morning. I was just wondering if there's anything in particular that you wanted to go through during the list?
Yeah, well actually I've really been struggling with using the air track. So the tube just doesn't seem to want to go in, and it always seems to go posteriorly.
Okay, so if you have a little bit of a think of situations where you might want to or need to use an air track, and then whilst the first patient's on the table, we can have a bit of a chat about those. And then in between cases, I'll get one of the airway mannequins so we can practice the skill. And then the last patient on the list is intubating, so we might use the air track for them. Okay, Rachel, so tell me what you know about using an air track.
So I know you use it in patients in whom you might be expecting a difficult airway, or if they've had a previous difficult intubation. But then again, you can use it in unanticipated difficult airways, and I think there's even been case reports of people using it for awake intubation.
So Rachel, it sounds like you've got a really good grasp of the uses of an air track, and also common pitfalls or complications. So I'll just go and get the mannequin, and then after this case we'll be able to practice using it. Okay Rachel, so first of all I'm just going to run through in real time how I would use the air track, just so that you can observe me doing it first. Right? Okay, so now I'll go through it a bit slower and also explaining what I'm doing as I go along. So the first thing that you want to do is select the correct size. And at the start you mentioned that you found that the tube often went posteriorly. That tends to happen if you've got a slightly too large. This next step, what I want you to do is, because there's quite a few different steps to a normal direct laryngoscopy, is if I perform the task but you're going to talk me through it and tell me what to do, okay? And if you need to ask any questions as we go along, that's fine, alright? So let's go.
So the first thing is to choose the right size.
Okay Rachel, so this one's your turn.
Okay.
So what I want you to do is to intubate this patient using the air track and talk me through, tell me what you're doing this time around, feedback on things as we go along, okay?
Okay, yeah. So I'm just going to choose the right size.
Okay, so let's break down that air track practical skills simulation session so we can think about what was going on.
Yeah, well actually I've really been struggling with using the air track. So
The first thing to say, there's no point in trying to teach an adult learner something that they don't need to or want to learn. So it's important to ask the learner what they want to get out of the teaching session so that you can target it towards them and their learning needs. Okay, Rachel, so tell me what you know about using an air track.
So I know you...
The first step is contextualisation. This is where you find out their pre-existing knowledge of the skill, things like the indications, contraindications, common problems with performing the task. This is really useful for you because it means that you can target your teaching and make it appropriate for their learning. I'm just going to run through in real time how I would use the air track. The second step is visualisation. This is where the teacher runs through the skill in real time with no commentary. This is basically behaviour modelling and allows the learner to create a mental model which they can then use to compare their own practice to. Over the mannequin, and it states on the side, it tells you the size of the air track and also the next step is verbalisation. This is where the trainer runs through the skill at a slower pace with a running commentary. This allows the learner to perform symbolic coding which aids their retention and retrieval of information that they've seen and heard. Endoscopy is if I perform a task but you're going to talk me through it and tell me what to do, okay? And if you need to ask me... The fourth step is transition to the learner. This is where you perform the task as the trainer, but the learner is telling you step by step what to do. This step allows you to confirm what the learner has picked up so far and any areas where you might need to strengthen.
Okay, yeah. So I'm just going to use the right sized air track. So
the final step is deliberate practice. This is where the learner themselves performs the task. It helps them in repeating the task in clinical practice, and also it's an important step for you to provide feedback on their skill. So that's the end of the teaching session. By now you should be able to describe the spectrum of expertise from novice to master, describe the Kolb cycle of learning, describe the 5-step teaching technique, and also demonstrate the 5-step teaching technique for a practical skill.